Hi everyone, it's me. I'm going to be doing some filler today, 2 weeks before my wedding. It's a little bit risky to be doing a little bit of filler because I could get a bruise. I highly recommend people do filler about a month out from any important event, but I'm on a tight timeline and there was just not enough days to get everything done. So here goes. I am going to put a little bit of filler in my cheeks, and I'm also going to put a little bit in this area down here by the marionette area. And I'm also going to address my lips because the cheeks, I'm just wiping off all the numbing cream, so I'm actually really numb. I can hardly feel my face right now. It's a really strange feeling. But you can see that if I put a little bit of filler in here, it really affects this area here. It makes it look a little bit less saggy, I guess, for no other word. So really a little bit goes a long way for all of that area. And then I'm gonna do some lips. So my favorite filler for the cheeks is Voluma. And because I was also involved in the investigations for Voluma to get FDA approved, I'm also a little bit biased, but it is a great filler. It has, it's kind of thick, and a little bit goes a long way, and I'm actually able to really get a nice lift from the product by just putting it in my cheeks. And then I'm going to put a little bit right here, which is also one of my favorite places for it. Okay, so I just wiped off my entire face with a surgical scrub called Cleanse, and that helps to prevent infection. And infection and bruising are the biggest, complications that happen with filler, the most common complications that happen with filler. So you can see I kind of pull and prod along on my cheek here. And actually right down on the bone. I feel like this is kind of my problem side. I like this side better than this side. Everybody has a good side and a bad side. Just a little bit more. And I'm oozing right there, so you can see I'm just gonna keep my finger on that spot because that helps to prevent bruises. So you might have been in here for filler at one point or another and you just feel me holding pressure on your cheek. And it's because you're oozing a little bit and I wanna try to prevent a bruise. Beautiful. I just feel like I just need a smidge more right here. Good. I like the way that looks. All right, now I'm going to put a little bit on this cheek, kind of right here, just to give me a little bit of lift. I don't think this cheek needs as much. All right, so I've actually only used about a half of the syringe right now. And this is really just kind of fine tuning because it's been really less than a year since I've had Voluma in my cheeks before. And Voluma is supposed to last about 2 years from beginning to end. So nobody likes to go all the way back to their baseline. 2 years is what it takes to go all the way back to baseline from when you first get Voluma injected for most people, although there's a bell curve. So the bell curve is the majority of people are in the center, and it can take a long time for them to get back to normal. Some people rapidly metabolize it, and I do have some people that come in, they're like, is there anything that lasts longer? And we do have some products that do last longer. Just need a little bit more, but they tend to be a little bit more of products that will stay around for years, like Bellafill. And I do think that there's a place for Bellafill. I do like Bellafill a lot for some certain places. If you have very deep marionettes, Bellafill is a really good filler for that. All right, now just a smidge more right here. Okay, now I'm gonna do my lips. So, as we age, the most disheartening thing is I'm getting a little bit of a, turn my eyesight away from my cheek as I was pulling out that extra syringe for my lips, and now I'm getting a little bit of a bruise. So that's the reason why you do filler well in advance of important events, because you don't want to bruise. So I'll have to laser this bruise to make it go away a little bit faster. I'll use some Ocumen pads. All these things work really well. And of course I might end up having to resort to some professional makeup. So as I was saying, as we age, I think one thing that everybody hates are these little lines that people get on your lips. You can see I have kind of subtle ones. I've been filling them as I go, so that they don't really get too bad and create, you know, deep lines and feathering of the lipstick. And so really right now it's just a little bit of a touch up, and I might put just a little bit of a pop right in my lip. I was born with big lips, and so I don't really need a lot of filler in my lips, but I do want to maintain the structure of my lip so that it doesn't collapse, because you probably have noticed for many people, as you age, when these lines start coming, the lip just doesn't have as much show. And when I create some support in the upper lip, you get your lip back without even putting filler in your lip, and it can look very, very natural. Of course, I'm all about looking very natural. I think that stopped bleeding now, so hopefully I don't get too much of a bruise, and hopefully I caught it in time. Okay, on to the fun part. Lips are really fun, something that I really enjoy doing, and by habit I just took that sticker off, so I'll have to have, I actually make a chart for myself so I can remember exactly what I did and when. So for a lot of people, I actually use a cannula in the lip. I can't do a cannula in my lip, but I can stick a needle in my lip, so that's what I'm gonna do. And I like to address each one of these little lines individually. See that, how it went away? Much better. Just a few little sticks. Not to look puffy, just to keep my lips looking like my lips. And now I'm just gonna hold pressure here for a second so I don't get bruise on my lip, because that would be kind of obvious that I did something. Not that it's obvious that I didn't do something, because I'm videotaping it. Okay, I really like the way that looks. Now I'm gonna put just a smidge right in my lip. All right, so that's really just to make my lip look a little bit more hydrated and perky with lipstick on. All right, so there's not much left to do before the wedding, not much time to do it in. There are all kinds of other things that I wish that I had time to do, and I might have to continue this series after the wedding. You're gonna see a video next week of Botox that I'm doing in my neck. And I actually did it earlier this week, and so we can kind of see the results in sometime early next week. And so stay tuned for that video, and I think that might be the last one in the wedding series. Okay, so a little while ago I was doing filler on my cheeks, and I actually got a little bit of a bruise. And so a service that we provide here for our patients after filler is a little bit of laser work with the BBL or IPL can really help the bruise resolve a lot quicker. Sometimes if it's a really purple bruise, by the time you leave, it's actually just like pink. So it really speeds up the resolution of the bruise. And because I only have 2 weeks left until my wedding, I just really don't want to have a bruise on my cheek.